numbers of children who get the HPV vaccine. Doctors say that leaves 2/3 of Texas children without a key defense against 6 types of cancer. Now the Texas HPV Coalition has a new message for parents. KXAN's Phil Prazen has the story.
And the doctors.
Nicole Kucherman has 3 kids at 17, 14, and 10. She had reservations when her first child got the HPV vaccine.
I talked to my husband, I talked to my peers, I talked to my family, and I talked to doctors, and after gathering all that information, really, I make my own decision.
After her doctor recommended it, she says she sided with the science and feels good about it.
The more kids I had, the more comfortable I got with it. And when you see that there is no reaction, you feel better about it after a while.
The Texas Medical Association and the American Cancer Society plans to place ads, flyers, posters, and brochures in doctors' offices and in public places in Texas. Their goal is to get lawmakers to require doctors to provide information on how the vaccine can prevent cancer. But there's some resistance since HPV is primarily a sexually transmitted virus.
There is the concern of why now? Why so young? Is that going to promote sexual activity in my child? Studies across the board have shown that that is not true.
The ultimate decision revolves around peers and parents. As for Nicole, her son will get the HPV vaccine next year when he turns 11. Phil Prazen, KXAN News.
When the HPV vaccine first came out, then Governor Rick Perry tried to require it for young Texas girls. But after backlash from conservative groups and voters, state lawmakers reversed his order. The CDC says children should get the vaccine at 11 or 12, so they're protected before ever being exposed. HPV vaccine also produces a higher immune response in preteens than in older adolescents. Local health officials think almost a quarter of people who live in Travis County have HPV. That's almost 300,000 people. Many won't even notice any symptoms, but they estimate about 100 people in Travis County develop some type of cancer each year from HPV. The majority of those cases are in women. Rate nationwide. 65% of girls and 56% of boys start the HPV series, but only 43% finish the series. In Texas, fewer than 50% of adolescents receive the HPV vaccine, but Austin numbers are harder to come by. Our Sally Hernandez started to look into how many teenagers got the HPV vaccine 2 years ago.
Yeah, I'm a parent first, so I had a whole lot of questions when I started to look into the numbers. But gathering HPV vaccination rates statewide and locally was a challenge 2 years ago when I started to look into this, and I found out it is still a challenge today. It is a problem the Texas HPV Coalition is trying to fix. I checked in with Austin health officials, and they can only provide us with data from the city's public health clinics. Here's what I found out. In 2016, more than 260 people ages 11 to 26 received the HPV vaccine from the Austin public health clinics. Last year, that number was slightly down to 2,048. Now, city officials tell me the vaccine is covered by insurance, but if someone is uninsured, they can receive the vaccine at Shots for Tots or the city's Big Shots clinics. All you have to do is call 512-972-5520. We'll link that number to our website, KXAN.com. Sally Hernandez, KXAN News.